Our ambition should be to break down the barriers between private and public provision. In effect, denationalising the provision of healthcare in Britain. That's a quote from Direct Democracy, a book co-authored by Jeremy Hunt in 2008. This week, junior doctors go on strike for the 4th time. They oppose new contracts drawn up by that same Jeremy Hunt. But is there a connection between this drive to denationalise the NHS and the junior doctors' dispute? And which side will prevail in this struggle over Britain's most cherished institution? Welcome to The Fix. Joining me to discuss the junior doctors' strike and the future of the NHS are Aislinn Macklin-Doherty, a junior doctor working in cancer treatment, Youssef El-Gingihy, a GP and author of How to Dismantle the NHS in 10 Easy Steps, Paul McCrone, Professor of Health Economics at King's College London, and Ellie-Mae, a journalist writing for The Guardian and The Independent. Thank you all for coming. Here's the newsreel.
For the first time since 1975, the British Medical Association is in an industrial dispute with the UK government. Beginning with a clash over the pay and working conditions being offered to junior doctors, the strike also highlights issues of privatisation and underfunding in the NHS. Junior doctors have withdrawn their labour 4 times in 2016, with 98% of those voting in the strike ballot supporting industrial action. The BMA has now announced a planned escalation of the strike, following Jeremy Hunt's decision to impose the contract, despite opposition from doctors. Although the Tories have long declared their support for the NHS, Britain's spending on healthcare is in decline. By 2020, the UK will spend £43 billion less per year on its health service than the European average, with Greece, Slovenia and Italy all now spending a higher proportion of GDP on healthcare than Britain. The Tory vision for the NHS promises a future of privatisation and systematic defunding. While industrial action by junior doctors demonstrates the willingness of public sector workers to mobilise against austerity, strike action in the UK is at historically low levels. Following the Thatcher government's assault on trade union rights, the number of unionised workers declined sharply, diminishing labour power and rendering public services fragile. A win for the junior doctors could change this trend. As Osborne's austerity agenda continues to bite, the left looks to campaigns to save the NHS to mobilise support for a more progressive politics.
We'll begin our discussion with the 1-minute round, where each guest has 60 seconds to answer the same question. Today, why are the junior doctors on strike? Youssef.
Well, I think the imposition of the junior doctor contract is really the straw that broke the camel's back. It comes on the back of many years of not valuing or treating NHS staff with respect. So we've had pension reforms, we've had a pay freeze, despite recommendations of increasing pay, which Jeremy Hunt has completely ignored. And so junior doctors quite rightly feel that this new contract will endanger patient safety. It will not value their work by making them work more for less. And it's really part of a bigger picture of privatisation of the NHS, because of course what you have to do is to break the allegiance of staff to the concept of a public healthcare system, and you've got to restructure the workforce. So that's really what seems to be behind, that seems to be the hidden agenda behind the idea of a 7-day NHS, is that bigger strategy of really what's been a 30-year project of NHS privatisation.
Brilliant, thank you. Ellie-Mae.
Why are doctors going on strike? It's because striking is the only bargaining chip that junior doctors have. When you work, you enter into a contract with your employer, which is that your employer provides you with a salary and decent working conditions, and in return you provide skills and labour. So when your employer removes their side of the contract, i.e. the decent working conditions and the salary, you must then remove yours in order to redress the balance of power. This is the only bargaining chip that doctors have. They don't have any other choice but to do this. And I think we need to remember that this is taking place in a context where the right to strike is under attack. We already have the worst bargaining rights in Europe, in Britain. And the government is about to introduce new legislation that will make it even harder for workers to go on strike. And remember that Jeremy Hunt has already said that he's going to impose the contract anyway, which I think demonstrates how important it is to strike, and also how little power workers have actually in this country when their employer decides to do something they disagree with.
Brilliant, Ellie. Paul, your 60 seconds.
Thank you. Junior doctors, I think, have very real concerns about their position, their situation, and the NHS more widely. The part of the new contract is to treat Saturdays as just like any other day, and it's true, people get ill on Saturdays, so they need to be admitted to hospital on Saturdays sometimes, and so it's of course important that we do have a 7-day NHS, but I think we already do have that. Junior doctors work 7 days a week as it is. But the conditions in the contract are such that junior doctors have very real concerns about the safety of patients and of course their own position, their own working situation. That's very important. And this whole idea of trying to introduce a 7-day NHS, it's all based on research that has been done which looks at the death rates for people who have been admitted to hospital over the weekend. And it's good research, but there's all sorts of caveats, and we've got to be very cautious with that research, and we need to look at that a bit more closely, I think.
Brilliant, thank you. And Aislinn?
So I'm a junior doctor who's been working in the NHS for 8 years, and I totally agree with Youssef, actually all of you, that this is part of a wider attack on the NHS workforce. I have seen firsthand doctors being totally removed from the decisions about how to best care for patients, and what's happening with this contract is that is being played out on a national level. So we are being told that 5 days worth of resources is going to be stretched over 6 days with no additional doctors, nurses. Hospital beds are being closed left, right and centre. We are telling the government, we are the professionals on the front line, telling them that patients are going to be put at risk. People are going to die, and they've ignored it. They've not just ignored it, they've told us that we don't understand the issues. And that's seriously concerning. So I think we have a right to strike, to stand up for what's happening in the NHS and to stand up for patient care.
Brilliant. Obviously many of these changes are quite complex and often confusing. To make this more understandable for the audience, could you just tell us how would your life be different if these contracts were imposed?
Well, I think firstly it's important for people to understand how our lives are at the moment, because that's how we've arrived at this point of desperation, to be honest with you. So I work Monday to Friday, and then 1 in every 5 or 6 weekends. I do a 24-hour shift, approximately once a week. And every now and again, and this has happened on a handful of occasions over the last 6 months to a year, you arrive at a shift and where there should be 5 or 6 doctors, there's only 3 or 4. And what that means is you suddenly take on the workload of double the number of patients who you've not previously met, you weren't previously looking after them. And it's dangerous, sometimes it's dangerous, but you do it because you care and you really want to look after the patients to the best of your ability. The real concern is when this contract, if it is imposed, we will be working infinitely more Saturdays. So who's covering the Tuesday that I'm not there? So my week will now be maybe Monday, Wednesday, Thursday, Saturday, Sunday. Who's covering me during the week? Because there's no one else that's being employed. So the gaps are risk to patients. It's real risk to lives.
And to move on to that longer term agenda, you've mentioned privatisation. What do you mean when you say there is an agenda to privatise the NHS?
Yeah, I think that's the absolute crux of this. It's absolutely fundamental, and it confuses a lot of people because they don't really understand how the NHS is being privatised when they still go to their GP or they still go to hospital, and it's free at the point of delivery. Everything on the surface appears the same, so that's very confusing to the public. I think if you're going to get technical, you're looking at definitions from the World Health Organization by which the NHS is being privatised. So what's happening in the NHS has been happening by stealth for the past 30 years or so, and it's accelerating. What you're seeing is, of course, a significant increase in outsourcing.
Outsourcing, which is?
So outsourcing where you're seeing the provision of health of NHS services, whether they're kind of frontline or clinical services or even non-clinical services, increasingly by the private sector particularly. And you're seeing it in all kinds of other ways. It's not just outsourcing. You're seeing, of course, the first step was the introduction of an internal market, and then there were public-private partnerships followed by outsourcing. You're now getting a situation where most contract, well, sorry, I'll revise that, not most contracts, but certainly large numbers of contracts are being effectively forced into tenders, which a significant number of which are going to the private sector. But I think we've got to remember in the middle of all this discussion, it's not really a question of kind of opinions or, ooh, is this happening or isn't it? This kind of very almost laughable kind of academic discussion that was taking place around the time of the election in the mainstream media. This is, there's been a very consistent narrative of trying to privatise the NHS over the past 30 years, and I think it's heading towards an insurance system and charging. And if you look at all the key players involved in this, they're all on the record as being very clear about this. In their public pronouncements, there's a lot of spin and a lot of, frankly, lying. But
And if the NHS is still free at the point of delivery, does it really make a difference to the ordinary person on the street who's providing that service, if it's the state or private companies?
It may not seem to matter, but it is absolutely fundamental. So if you take something like PFI, it's an absolute scandal. So these private finance initiatives where hospitals, and in fact all kinds of infrastructure, were built by these consortia of banks, financial companies, construction firms, facilities management companies. They're an absolute scandal in that if you take hospitals, which were the largest part of them, you're going to end up paying in the form of the NHS and basically taxpayers and so on are going to end up paying up to an extra 70 billion pounds. So if you build those hospitals in the old way, much more directly from the Treasury, for example, and especially at a time when there are ultra low interest rates and you can just borrow this money fairly cheaply, you would have built those hospitals for about 11 billion. You're going to end up paying up to 80 billion, and that just money gets siphoned off into corporate profits instead of being invested into patient care.
And Aislinn, do you see a direct connection between this strike and privatisation?
Yes, I do. As I said earlier, when you're in the environment and you're in the hospital, you see every day the changes and how they affect your work. So, for example, managers now have the ability to tell us how to look after patients. They now overrule how we structure our teams.
That's a manager who's not medically trained. That's
absolutely
a corporate person.
Business background.
A business background, okay.
Yeah, and they're saying, oh, we need this number of doctors for these number of patients. Sorry, why? Can we have a say in that? Well, no, we've just decided we've made the rotas like this. There's these gaps here we've not filled. You guys, because you care about patients, you have to fill them and just carry on. So you're just seeing kind of this very slow restructuring of how we can provide patient care. And also the administration with PFIs is huge, and that's what this whole kind of tier of management is all about. It brings in inefficiency, it disenfranchises us from being able to look after patients, and then this contract is the straw that broke the camel's back, and that's why we're kind of out on the streets protesting these changes.
And Paul, even if this giving influence to business people or people from managerial backgrounds is unpopular in the NHS, could we argue it's necessary? I mean, there's a hell of a lot of money going into the NHS. Is it not business people who know how best to manage it?
I mean, I think it's certainly the case that we need more funds going into the NHS or into healthcare, in general. And of course, there's been a big debate over the years about how much of the healthcare system should be privately organised, privately financed. Some would argue that none of it should be. Others, that it should be a fully private system, and many people are in between those extremes. The thing is, healthcare is expensive, and I think it's whether there is political will in order to fund the NHS adequately. I mean, it is a political decision. It's not an economic decision, really. And of course, there's trade-offs. The more that we spend on healthcare, the less we spend on other things. So,
the question is efficiency, right there, because there's the amount we spend and then what we get out of it. So, is the government arguing that we get more out for less buck if we have managers in there in private organisations?
Some in the government would definitely argue that the more that you bring market forces into play, then you do get efficiencies. I personally struggle with that argument. I think when you have an organisation like the NHS where you can't have, yes, you can have competition between providers, but essentially you're providing something that isn't really marketable in that way. It's not like buying a computer or, you know, a tin of baked beans. It's, you know, and there will be some areas of healthcare that will be unprofitable to cover. And so if it is left entirely to market forces, then yes, there'll be certain treatments that will be provided. There'll be very profitable treatments. Some will be totally underprovided.
Youssef, the government are justifying these changes by the need for us to have a 7-day NHS. Do you buy this argument?
I think largely the 7-day NHS is a smokescreen.
Yeah.
This is not. If you look at all the past 5-6 years of the government's rhetoric about modernisation, patient safety, improving services, it's very much smoke and mirrors. At a time when they've actually had huge stealth cuts to the NHS, and the NHS has undergone its the biggest squeeze since its inception, really, in terms of funding. But you've got to remember that someone like Jeremy Hunt is on the record as being specifically in favour of dismantling the NHS, or at least in the book that he co-authored with others. And the same applies to all these key players. So if you look at Nick Seddon, for example, who's David Cameron's main health advisor, again, very much on the record in the Telegraph as being in favour of introducing insurance, and that goes on and on and on.
And we can talk about the efficiency or non-efficiency of the NHS, but also politics obviously comes into this, right? So what do you see as, Ellie, I'll ask you, what do you see as the main forces driving these changes to the NHS, driving the marketisation or privatisation of?
Well, I think in that respect, in one respect, the NHS is no different from any other publicly owned service, in the sense that successive governments over the last 30 years have wanted to sell them off. I mean, pretty much every other utility that we have has been sold off over the last 30 years to the private sector. Why would the NHS be exempt from that? There's no logical reason as to why they would say, well, we have this overarching ideology that the market forces are superior. You know, it's something that we decided 30 years ago.
Who has that overarching ideology? Is this a Tory
well, I
thing?
say we. I suppose what I should mean is that it was ushered in under the Thatcher government, but it's been accepted as received wisdom by a Labour government that followed it. And there's not really, I mean, I think Jeremy Corbyn is probably the first example of a mainstream politician who hasn't accepted that argument. But because of the overarching ideological belief in British politics over the last 30 years, the railways have been privatised disastrously, I might add. Utilities have been privatised, gas, electricity, and so on. There is no logical reason as to why they would say, well, our ideology is good for all of these publicly owned assets, but not this one. So I think really it's, you know, there's no sort of conspiracy here. We just have to be logical about it. You know, this is what they believe for all of this other stuff. And it was a bad idea for all of those things. So the fact that it's a bad idea for the NHS isn't enough to make that exempt from, you know, this is the way that they see the world, the government, and it's the way that New Labour saw the world, it's the way that the government before them saw the world, and it's also the way a majority of the media and people working in business see the world. This is conventional wisdom now, that the market knows best, and that privatisation is more modern and more efficient, even though, you know, there's a lot of evidence that shows that isn't the case. And even though around the world, a lot of other countries, even the US, are starting to bring public assets, particularly water in the US, back into public ownership because of the disasters.
No, just because of time, sorry.
No problem.
We've been discussing the changes being wrought on the NHS. Of course, these have not gone uncontested. Here's footage of junior doctors on strike and reactions from Jeremy Hunt.
Junior doctors are in a very desperate position right now. We've marched in our tens and thousands, we've signed petitions in our hundreds of thousands, yet the government still fails to listen. We've conducted 2 24-hour strikes and the government hasn't come back and listened to our concerns. We now face an imposition in only a few months' time, and we're left with no other choice to take to the streets. But we do this with a heavy heart because no junior doctor wants to strike.
Well, we have been trying to sort this out through a patient process of negotiation for the best part of 4 years. And in June, having won an election and it being in our manifesto to have a 7-day NHS, I again asked the BMA to sit round the table and discuss it, and they refused. And even before any discussions had happened, they balloted for strike action. And I think that is incredibly disappointing. And yes, that does leave some poison. And I think it's highly regrettable, because I don't think that what I want is different to what any doctor in the NHS wants.
The resolve of the junior doctors has been strong up to now, and public support remains high. Yet Jeremy Hunt still seems confident he can push through his changes. Aislinn, how do you think this dispute will end? Which side will win out?
You've got, highly skilled, motivated, driven professionals, many of whom have, like myself, have dreamed of being a doctor since we were very young. So for us to take the action to leave patients for a day or for 2 days is huge, and there's been a lot of conflict with a lot of different doctors. So I think it shows the level of feeling. But what I would say is that we have the truth on our side. You saw Jeremy Hunt's clip. The level of double speak that comes out of that gentleman's mouth is unbelievable. And I think the public get that. I speak to them. We know them. We've met them. They trust us. They know that we haven't got some ulterior motive here. We really haven't. So although it has been very disruptive and upsetting, I'm seeing a level of unification and togetherness in the profession I've never seen before. And that, together with the open support from the public, it's quite empowering. And I think there's hope, and I'm really hopeful about the future.
Yeah. I think it's interesting to mention truth and trust there. And I feel like trust is what is really key here. And at the moment, the doctors have on their side that the public trust them. The public trust doctors more than they trust Jeremy Hunt. I feel in the future, or Jeremy Hunt's hope, is that this strike will drag on so long that people lose that trust for junior doctors. Instead of seeing them as fighting for the NHS, they see them as fighting against the NHS. Do you see that as a danger?
That depends. It depends on what the doctors do next, because there are going to be stories about the NHS failing patients over the coming weeks and months because the NHS is being starved of cash, and the government will attempt to pin that on doctors. So I think what doctors need to start to make sure that they do, which I think they've been doing a very good job of, is to show that any problems in the NHS in the coming months is a political failure on behalf of the government, and not because doctors are going on strike. And I think the way that they do that is they build outwards, they engage patient groups, they engage other community groups, they engage other workplaces that have been affected by government policy, and they demonstrate that this strike is not just an industrial issue about a particular contract relating to some doctors. It's a social issue about the health service that affects us all. And if they're able to do that, I think that public opinion will stay on their side.
Part of that's going to depend on how this is covered in the media, right? I'm going to ask you, as someone who sometimes writes for The Guardian, how do you think this will develop in the media over the coming months?
I think there's been lots of unfair coverage towards the doctors, but I also think that they've had better media coverage than strikes do, generally speaking. On the whole, which is more of a reflection of the terrible coverage that strikes get, rather than saying that they've had it easy, because they definitely haven't. And I think that that's because doctors are members of the professional class, who, this sounds like a trivial thing to say, but it isn't, but doctors are more likely to know journalists socially than other professions who go on strike, so there's more empathy there. And also, as you mentioned earlier, because of the high levels of trust that patients have for doctors. There's lots of examples in even recent history where the public have disagreed with the government on certain issues, and that's because the public aren't passive robots. Politics is the art of making convincing arguments, and I think the government is not at the moment, and the negative press coverage is not making a convincing argument to the public, whereas doctors are. Yeah.
Can I add to that? There was a recent piece of research that was done, I think it was the Health Services Journal that published it, which was an international study in Europe of the public's perception of their own press. So their opinion of how they see their press reporting on a variety of issues. And I think it included about 10 countries, Eastern European countries, Germany, France, Spain, the UK. The UK was by far classed as the most right-wing according to the public's own opinion. So,
Okay.
you know, that's, and it's
So the public
comparable.
don't see the press as neutral.
Exactly.
Which bodes well.
Which is interesting, isn't it? It's very interesting.
To take us back a few steps, this is in large part a defensive struggle. The government want to make a change to the NHS. We don't want them to make that change, or junior doctors don't want them to make that change, to keep my impartiality. What is the NHS we want to see? Is this merely a defensive struggle, or do we have a future vision for the NHS as well? Do we want it to change in any way, Paul?
Yeah, I think the discussion we just had fits in very well with that question, actually, because the context is hugely important. I think the action that doctors are taking is very popular. That's because the NHS is very popular. Mm-hmm. So if nurses were taking similar action, they would get support as well, because at the end of the day, the NHS is a very valued institution. It's a bit of a cliche to say that, but it is. People do value it. It's a national treasure, and I don't think that's going to change in the short term. So I think, as long as I think public opinion will remain in support of the action that's been taken, but I think public opinion is also very much in favour of maintaining funding in the NHS, increasing funding, and I don't think that there hasn't been a government recently that's really had the guts to say, yeah, we need to increase funding on the NHS by quite a substantial amount, and it's affordable. I mean, that's because
the narrative we keep hearing is that we used to be able to afford the NHS, but now with an ageing population, with tight budget, budgets, we just can't anymore. Something has to give.
I think that's that's a view that is often. People often come out with, politicians often come out with that view, and I think it's a false view. I think, it's a real view. I think it is false. I think the NHS is sustainable, and we can spend more. I mean, we in many areas of the economy, we see huge advances in productivity. I mean, all the equipment in the studio here is very much more affordable than it ever used to be, because it's a capital-intensive industry it comes from, whereas healthcare and education, these are labour-intensive industries. So as an economy develops and grows, we should be spending proportionally more on those sorts of areas of the economy. And so, how much should we be spending on healthcare? At the moment, it's 8 or 9%. I think we could easily afford to spend more on healthcare.
I mean, ultimately, this will have a lot to do with political will, right? I mean, we spend 9% of our GDP on the NHS. In America, where it's private, they spend 17% or something like that.
Well, more than that.
More than that.
And the levels of inequality are staggering.
Yeah.
Does anyone see the political will to get that 9% up to 11%, up to 12%, and it still be government funded? Can you see that happening?
Well, there's when we talk about these kind of vague terms like change or reform or political will, the political will is completely in the opposite direction. You've got to remember, this is, when we get lost in the small print of a contract dispute, or Jeremy Hunt, who's just a figurehead, you've got to remember this is actually a global capital project to open up the oyster of over $100 billion pounds of the NHS budget, and it's a long-term project. And if you go back to the 80s, you go back to those think tank papers from Oliver Ledwin, John Redwood, and others. From Thatcher's think tank, the Centre for Policy Studies, the Adam Smith Institute, it's all very clearly spelt out that the final aim, if you look at those documents, they actually take us through all the reforms that have happened. And they go on to spell out that we should be introducing a universal private insurance system. So that's what they've tried to kind of hide from the public, because they know it's a national treasure. They can't come out and actually, and that's what Michael Portillo even said after the election, didn't he? The previous election, I think it was, where he said if they told you what they wanted to do, you wouldn't have voted for them. So that's why there's all this smoke and mirrors.
Okay, so we've run out of time. We're going to move to the last 1 minute round. I want predictions, but also action points. Youssef, you're up first again. Does the NHS have a future? And how should we fight for the NHS we want to see?
I think we've got to remember that we are really far down the road to introducing private insurance, and it's going to happen in all kinds of insidious ways, like giving people personal health budgets. We've had a massive piece of legislation, the Health and Social Care Act, which is a privatisation act. We've now got this 5-year plan from Simon Stevens, the NHS chief executive, which very clearly spells out all the kind of talk about US insurance systems, and it's quite explicit about things like accountable care organisations and so on. But I am absolutely an optimist. I believe that we can really restore the NHS. In fact, we've got the legislation, which is the NHS Reinstatement Bill that was in front of Parliament recently, which would do that. It would restore and renationalise the NHS. Of course, the government is against it, because when they say that they care about the NHS, it's just rhetoric. So I absolutely think we can win that fight if we back that kind of legislation and we get sufficient kind of grassroots mobilisation and national campaign behind it.
Brilliant, thank you. Ellie-Mae?
Of course we can win this. Of course we can have a universal healthcare system that's funded as much as we want it to, because anything is possible politically. Of course it is. You know, we founded the NHS in the first place. We can do it again. The question is how we do it. You know, and that's really what we need to talk about, not whether it's possible, because everything is possible in politics, as I think Donald Trump should demonstrate to us. How do we do it? Well, I think what we need to do is demonstrate the importance of a universal, publicly funded healthcare system. We need to make that argument convincing to the public. We need to demonstrate what happens if we don't have that. And we also need to make the case that it is politically possible for an NHS to be universal and to be well funded. And I think that's a very long question of how we do that. That takes more than a minute. But those are the sort of tick boxes that we need to fill if we are to protect our NHS and to improve it.
Brilliant. Paul?
I agree. I think, you know, we and politicians need to treat the public as grown-ups and tell them, you know, this is how much healthcare costs, and it's, you know, because something costs a lot of money doesn't mean that's not bad. It's the reality of the situation. And I think if we're very honest with people, and you know, say that, you know, if we want to have a publicly funded healthcare system, this is what it's going to cost. This is what it's going to cost in terms of taxation. You know, if we want to raise the money that way, this is what it's going to cost in terms of spending maybe less in other areas. You know, and I think people would buy this argument. And you know, if we hear that, you know, here it said that the healthcare system, the NHS, is unsustainable, and I think if people buy that argument, and I hope they don't, then that will allow more privatisation, because, you know, the argument will be that, you know, we can't fund it out of public money, so we've got to get the private sector in. And you know, I think there is a counter argument to that needs to be heard a lot more.
Brilliant. And Aislinn?
Well, yeah, funnily enough, I agree with all of you. Yeah, I think the key here is honesty. And it's just very telling that politics has become a bit of a dirty word. It's actually, I looked it up, the definition in the dictionary, because I was brought up to believe politics meant what kind of society do you want to live in? What's your value system? What's important to people and how they live? But actually now number one in the Oxford Dictionary is politics as a mean of gaining, you know, personal support or personal interest. So I think that's very revealing, and that's exactly what we're seeing with the politicians here. So we need to, I think, get back to honesty in politics, educate ourselves and the public about what's happening in the NHS. The NHS is gone, really. And the evidence is there that it was the best healthcare system in the world. If everyone gets that, then we'll all be on the streets fighting to get it back.
Brilliant. Thanks for all those answers, and thanks for coming on the show. You've dealt very well with an often complex subject. And thanks for watching The Fix. You can follow us on Facebook at The Fix TV, follow us on Twitter at @TheFix_TV, and of course tune into Novara in 3 weeks' time for our next episode. See you then.